A good medication management system will improve patient safety, will improve quality measures in a nursing facility, and it will help reduce rehospitalizations. I am passionate about medication management because as a pharmacist, that's what I do. I always assume it's the medication causing the problem or side effect until I can prove otherwise. And using this as my motto, I'm going to protect the patient from an adverse event related to meds. I chose the topic of medication management because it's such a broad topic, it can actually be really overwhelming for a lot of people to know where to start. So my goal was to identify at least 5 areas where we can do a better job by using regulatory guidance and evidence-based practice. The first thing we can do is take better care of our residents with dementia that are presenting with behavioral expressions. We need to see what's going on and get to the root cause of that. Is it environmental? Is it physical? Before turning to a medication. Consonus is part of a national initiative to reduce antipsychotic use. We've seen about a 34% reduction as a profession over the last 6 years since there's been focus on reducing antipsychotics. That's great, but there's a lot of opportunity for further reductions. The second thing we can do better as a profession is antibiotic stewardship. And there's some small changes within a facility we can make that would have a huge impact. It's really a culture change with the way we think about antibiotics. We can stop asking for testing that will lead to antibiotic use that's not needed, such as a urinalysis when somebody is confused or having a behavioral issue without any other symptoms. Consonus is taking the lead on antibiotic stewardship by being a part of the interdisciplinary team in facilities. Consultant pharmacists are educators and they can provide great value in that area. The third thing we can do is improve our diabetic management in older adults and specifically reduce the risk of hypoglycemia. One of the things we can do is work to eliminate the use of sliding scale insulin. We've known for a few years now that it's considered inappropriate for use in most situations, but yet we still see a fair number prescribed for residents coming out of a hospital into a nursing facility. The fourth thing I'll be focusing on is safer transitions of care. We can do a better job when people transfer from hospitals to nursing homes or into assisted livings. We could focus more on medication reconciliations to make that a safer transition. It is estimated that 60% of adverse drug events can be prevented with medication reconciliation at the time of admission or discharge. A good place to start would be on the most frequently prescribed high-risk medications, such as your anticoagulants like warfarin, your opioids like morphine, and then your hypoglycemic agents like insulin. An interdisciplinary team approach is really the key to medication reconciliation, with close nurse, consultant pharmacist, physician, and even patient collaboration. That's really the most effective way to ensure patient safety and also reduce costs as individuals transfer from one level of care to another. The fifth thing we can do is help reduce unnecessary medications. That's an area that Consonus is leading. That's actually one of the #1 recommendations our consultant pharmacists make, is to either reduce or discontinue medications that are no longer needed. Some of the common challenges that we see are duplicate therapy, excessive dose for an individual's age or their renal function, the duration, the length of time a medication is used, and inadequate monitoring. The solution is to involve a consultant pharmacist to help peel back the layers of prescribing and make recommendations for trial reductions or discontinuation of medications. If you don't have a good medication management program in place, the biggest thing at risk is your patients and safety. No matter where you are in the process, we can help. So I encourage you to call Consonus or call me.